introduction. So Duane is the business professional responsible for the development of the Source Health platform. And I will let Duane talk a little bit more to what that is. So he comes from a human factors and technical background and has worked across the medical and psychology industries in both the rural and remote areas, as well as in a city-based setting. So he has previously also worked on Flinders Island in Tasmania, and the practice he was working for was awarded the most improved inpatient outcomes in 2019, which is pretty impressive. So I'm going to hand over to Duane, and we're going to have a little bit of a chat about exactly what Source is. Let me just make you a bit bigger, Duane. Oh, there we go.
There we go.
Lovely to see you.
Hi, Chelsea. How you going?
Very well, thank you.
It's great to join in with all these wonderful people on Are You OK Day.
Yeah.
I've been tuned in for all the sessions, and I'm feeling like this big, but we'll get there.
It's been amazing. So tell us a little bit more
about
Source Health in general. So a lot of people wouldn't have heard about Source Health because it's relatively new.
Yeah, so Source Health is really a startup in the telehealth psychology type space. Although we're not really focused just on psychology, we want to be sort of broader into the more allied health professional space. But we are focusing a lot on mental health professionals. So it's not just psychologists. We are looking at social workers and other supports as well. We want to provide I suppose, a community of clinicians that would be able to support essentially communities across Australia. And that doesn't matter whether those communities are in a rural and remote setting or a city setting. We want to be able to be there when clients are actually needing to speak to or see a mental health professional to support them to overcome their own challenges that they're going through right now.
Definitely. And it's a very exciting initiative. And I think that one of the things that really excites me about Source Health is it's not limited to anything. You know, when you attend your psychologist at a practice, it's normally you're going there for ongoing treatment. But from what you've said about Source Health, it seems to be you can go for ongoing treatment, you can go for a couple of one-off sessions, you can just access it on an as-need basis if you want to. Yeah. It's completely accessible online. You know, it's pretty exciting.
So I wouldn't throw us in the sort of the crisis management or sort of an urgent case type space, but we are there for those ongoing conversations. And like you say, you know, it can be that you might just need to book a quick catch up with someone or be able to just sort of, you know, things aren't going so right. So, hey, why don't have a chat to someone and just see if we can get something going in sort of what's actually happening in my head and where am I going and try and just sort of figure some of those things out. And, you know, we're building this community and this network of clinicians all over Australia that's enabling us to be able to really match a person and what's going on for them at that time with a clinician that has expertise in that area. So, you know, whether it's we're looking at sort of generalized anxiety or depression or something a bit more complex, maybe some personality disorders or something that's just has a different level of complexity, then you know, we'll have the clinicians on board to make that happen and make it get those connections happening so that people can really connect with a professional who can help and support them through those challenges, but not necessarily in a place where, you know, they might be in a situation where they don't have access. They might be in a small town in rural Queensland or even in the Northern Territory, and they, you know, it might be hours trip to drive to see somebody, but, you know, they do have an internet connection, and they have the ability then to be able to actually connect one-on-one with a clinician, and the same in, you know, in some of the more busy city areas where they can't get away from work or from the situation they're going, but maybe they can, you know, they might be able to just sit down during their morning tea break, their lunch break, or even after hours to be able to talk to one of our clinicians.
Yeah, that sounds amazing. So tell me a little bit more about the type of people that can access or would be ideal to access Source Health services.
Well, we'd like to say that we're open for everyone. We want to be able to support people where they are, and whatever they're doing at that time. So yeah, really, it's a matter of just connecting, really. And it could just, like I said before, it could just be that you're just having a down day, but hey, let's just have a chat to someone. Or it could be that you're going through a rather significant event, or a series of events, or maybe there's something really big going on for you. But we're going to be there to be able to help you connect with somebody and be able to sort through that. Whether that, like you said, it might just be a single or a couple of sessions, but it could also be for the full length of a long period. It could be for a year, it could be for 2, it could be for a week. It's when we don't want to just be like, well, we're only focusing on certain clients. We want to be able to see and talk to people as they need us.
Most definitely. Thank you. So if somebody wanted to access some services through Source Health, how would they do that?
The easiest way is to jump on our website. We have a form on there. Currently, we have a form on there where you can put your information in, a little bit of information about yourself, as well as your details. And then we'd be able to make contact with you and be able to sort out a booking with a clinician. At the moment, the online booking sort of is just quite not there, but we're getting really close, and soon it'll be a matter of you'll be able to go on, have a look at the team, and see if any of the information that we present about our clinicians is sort of resonates with you. Then you can hit the connect button and connect with that, and connect with that clinician, make a booking to see them, and you'll be able to see what's available in their diaries for when they're available, and be able to go from there. We want to be able to make it so what's happening, and we know what's happening, and go from there. We do provide also that if you are going through something significant and it is urgent, then we do have phone numbers and links to say Lifeline and some of those other services that do provide an absolutely fantastic and critical service 24/7. And even today we've heard of a couple of services that may not necessarily be 24/7, but they do provide a critical service to vulnerable people in our society. So those will probably be added very shortly to our website, because I think they are great resources. And the more of a network of these resources we can get around, the more support we can give people. And I think it's really important that people are just have that ability to just reach out when they need.
Most definitely. That's such a key point. Thank you, Duane. So in terms of that "Are you okay" day conversation, so when you're asking somebody, "Are you okay?" when they say, "No, I'm not," what's your biggest tip, or your biggest go-to for how to say, how to respond?
What to say, how to respond. Look, like a lot of the speakers have already said today, it's be prepared for that and be genuine. But if you say to somebody, "Are you okay?" and they say no, it can just be something as simple as, "Well, what's happening for you at the moment?" And then from there, that can just open up the door to to have that conversation that can be a little bit longer. And then it might be the ability that it might just be that's all they needed. They just needed somebody to talk to, or it might help them to go, "Okay, well, how about can I connect you with somebody, or is there somebody that because they've opened up, maybe it's to something that maybe you and I can go and I can support you and talk to somebody." So it's about having a conversation, I think, and it's "Are you okay?" is opening the door, but I think it's about being genuine and caring to then have that ongoing conversation.
That's wonderful.
And not just for one day of the year on "Are you okay" day, but throughout the year, every day.
Most definitely. And I think that's one of the things that, it's very important moving forward with the current climate the way it is. But even if things go back to, for lack of a better word, normal, I think it's important that we do continue to have that conversation. That's one of the big things that has been highlighted by, I think, nearly every guest presenter, is that it's such an important conversation to have. So thank you for that. Right. Is there anything else that you wanted to add, or any other information that you want to give anybody listening?
No, I think we've sort of gone through everything that Source Health is sort of up to at the moment. Watch this space. We've got the Facebook pages. We've got the website. All that. jump on board and sort of have a look, and if there's something that you might be able to add, we're more than happy to be in contact, and let's start a conversation there.
Fantastic. Thank you so much, Duane. We will also
No
put
problem.
a link into the webpage for Source Health in our Facebook group as well.
Excellent.
So thank you so much for your time. Very much
No problems at
appreciated.
all.
Super excited to hear what's happening with Source Health moving forward.
All good. Okay.